Okay, so today we have Dr. Nikki Gawronski, who is the Director of Clinical Education over at New York Medical College, and we are both members of the Consortium. So she is going to take it away to talk about some helpful tips if you're a smaller clinic or if you're a new clinic to taking on students and you don't really have a lot of information of what to do when a student is placed at your site. So she's going to help you out with some tips for that. So I'll let you take it away, Dr. Gawronski.
Thank you, Caitlin. So first and foremost, when you are expecting a student, you should have at least the student's email address. So once the school has matched you with a student, you should have their information so that there is a point of contact. The school will then send a student packet, usually about 2 months, 6 weeks to 8 weeks before your clinical rotation or the clinical rotation of the student is set to begin. And within that packet, you'll receive the clinical education manual, which has all of the policies and procedures that the school follows. You'll understand which clinical education assessment tool that the school uses. There'll be information on training for how to use the tool and school specific benchmarks depending on the rotation of the student that you're getting. The student then should reach out to you with their student profile. In some cases, the school will send out the student profile, but you should receive that, and that's information regarding the student themselves. So what their goals are for this clinical rotation, you may see where they've gone. If it's their second, third, fourth clinical rotation, you may be able to see where they've been before. It'll have their emergency contact information, their compliance information, immunization records, things of that sort. It could be a very anxious time. The students, depending on if it's their first clinical rotation, or for you, depending on if it's your first student. So any preparation is really important. This year, or last year actually, at the Educational Leadership Conference, there was a roundtable discussion with a lot of stakeholders, SCCEs, CIs, DCEs, and we even heard from students about what is important to them when they're going on a clinical rotation. So some of those things are having a proper orientation to the facility. You know, there is some anxiousness about how do you get there, transportation, am I going to hit traffic, is there parking? All of these may seem simple, but they're really big questions that, if they're answered, could put a student at ease. So what we do recommend is that you contact the student ahead of time. If possible, maybe arrange an orientation so that they can come in, they can see the facility, they can meet everyone, they can see where their space is going to be. Is there a place for them to put their lunch? Are there restaurants nearby where they can go grab lunch? What does the facility layout look like? Is there parking? So all of this is really helpful information for the students. And then you'll have a sense of what the students' needs are. How do they like to receive feedback? How do they want to meet with you? Would they prefer meeting informally or formally? Do they like a sit down in the morning to prepare for the day? Do they want to sit down at the end of the day? Do they like a weekly session? You know, how do they like to receive feedback? So it's a good opportunity for them to ask questions and for you to ask questions before the busyness of the clinic kind of gets in the way. You will also want to know if there's any weekly learning objectives. Some schools require that students fill out a weekly goal sheet. Some schools will provide that goal sheet, and in other schools that's not required. So have that conversation with them. What are the assignments that the students are required to do during the clinical rotation? So these are some items that we really recommend that you have a discussion with the student before, so that both you and the student feel a little bit more prepared going into the clinical rotation. Best of luck.
All right, awesome. Thank you so much, Dr. Gawronski, for joining us today, and look forward to doing some more videos for the consortium to help everybody out with making clinical placements more seamless.